and welcome to the podcast, Care Delayed, Understanding Barriers to Mental Health and Substance Use Treatment, sponsored by DC Engage. DC Engage is funded wholly or in part by the government of the District of Columbia, Department of Health, HIV/AIDS, Hepatitis, STI, and TB Administration, also known as HOSTA. Our guest today is Patrick LeBlanc. Patrick is a certified trauma and resilience professional, a mental health first aid instructor, and a mental health advocate. Welcome, Patrick.
Thank you so much. Thank you, DC Health, DC Engage. I'm just so excited about the opportunity to share with you guys.
And we are so excited to have you. Can you talk a little bit about the disparities that exist for mental health and substance use treatment?
Let's talk about mental health and substance abuse real quick. Here's a dose of reality, and I use that word intentionally. Here's a dose of reality, disparities in access to treatment. The impact of drug use is felt across all demographics. It does not discriminate. However, some subsets of the American population are disproportionately affected by substance abuse, and the access to substance use treatment does unfortunately differ often by race and by gender. That could be all male facilities as opposed to all female facilities, more or less of one or the other. But then, as I mentioned earlier, just the name liquor as opposed to the name brand liquor stores. Minority groups or people of color may suffer from substance use and mental health disorders at a higher rate due to the difficulty in accessing care. The right kind of care are not being available. The environment, social and financial concerns are also barriers to treatment, just a dose of reality. Black Americans are seeing a disturbing trend in mental health disorders, including an increase in mental illness, depression, episodes of suicide thoughts occurring, and a lot of this is substance use and mental health disorders are closely linked because they will try to cover or mask the depression by using some kind of alcohol or some kind of drug. And what that does is just cover it temporarily, because when you sober up, the depression or whatever the issue was is still there. And so due to their inability to access the appropriate treatment, accompanied by the stigmas, many minorities will turn to unproductive methods of treatment. And most of that is self-medication. Drugs, alcohol, something to mask that stigma, that symptom of whatever that mental health issue might be.
Patrick, you mentioned barriers to treatment. Can you talk about that a bit?
All right, so here's some barrier to access. When we think about this, many individuals have common mental health disorders, but they do not seek professional help. 40% of people with a mental health disorder sought no treatment last year. Only 1 in 3 African Americans who need mental health actually receive it. What are some barriers you can think about in your community? Here are the 4 that are most general. How much it costs. Mental health treatment can be expensive. Substance abuse treatment can be expensive. And a lot of people, if they don't have insurance, even with insurance, I can't afford it. The stigma that's associated with that. We just spent some time talking about that. The logistics. How do I get there? If I don't have if I don't have a car, public transportation is going to take me some hours and time to get there. Can I miss work? Can I do that? And then the other thing is just the awareness. I don't know where to go to get this kind of help. It's not like going to your primary care, or though some here, what we're trying to do is integrate behavioral health into the primary care, but sometimes it's just bigger than that. Here's a snapshot of what it looks like. I told you a little bit about this earlier, but 1 in 5 Americans struggle with mental illness. But when you think about African Americans, 20% are more likely to have a serious problem. It's the 3rd leading cause of death of African Americans aged 15 to 24. African American men are 4 times more likely to die by suicide than African American women. I mentioned the statistics earlier. So here are just some things of why people are struggling.
As we close today's conversation, it's important to remember that barriers to mental health and substance use treatment are often rooted in stigma, access challenges, systemic inequities, and unmet social needs. Healthcare providers play a critical role in reducing these barriers by creating supportive, non-judgmental environments and connecting individuals to compassionate care. Thank you, Patrick, for this fruitful discussion, and thank you to all who joined us and your continued commitment to improving access and outcomes for the communities you serve.